The AP thoracic spine should be performed with the patient standing at the upright bucky or lying on the table with a 40-inch source to image distance. I'm going to place a right marker here on the right side of her body. I'm going to ask that she holds very still, and then the exposure is made. A diagnostic AP thoracic spine radiograph must be free of motion and rotation. Demonstrated anatomy to include the 12 thoracic vertebrae, aligned in the middle of the image with proper visualization of soft tissue and bony detail. Thoracic spine should be performed with the patient standing at the upright bucky or lying on the table. A 40-inch source to image distance. And here we're going to do the same thing. The central ray is actually at T7, and we're going to still center 1.5 inches above the level of those shoulders. We're going to use the coronal plane and then collimate from side to side. And now we want to use a left marker. We want to place this left marker anteriorly. A diagnostic AP lateral thoracic spine radiograph must be free of motion and rotation. Demonstrated anatomy to include the open intervertebral disc spaces with proper visualization of soft tissue and bony detail. T1 to T3 are typically not clearly visualized due to superimposed anatomy. Lateral swimmers, cervical thoracic spine should be performed with the patient standing at the upright bucky or lying on the table. A 40-inch source to image distance, and if needed, a 3 to 5 degree caudate tube angulation. The 3 to 5, centering here at 7, making sure I'm still centered to my IR. I'm going to collimate down to about a 10 by 12, keeping the left marker anteriorly. And we're going to have her take her arm and place it down by her body and pull the shoulder down. We're going to do suspend respiration. Patient's going to hold very still, and the exposure is made. A diagnostic lateral cervicothoracic spine or swimmer's view must be free of motion and rotation with adequate penetration through the shoulder region. Demonstrated anatomy to include the lower cervical and upper thoracic vertebrae with proper visualization of soft tissue and bony detail.